Today I'm going to talk about what it feels like to actually have your ingrown toenail removed. I know a lot of people are doing research and they see very scary videos and pictures on the internet. Well, my goal is to tell you exactly how your appointment's going to go to alleviate any concern, especially for parents that are, wondering where to go and what's going to happen to my kid. All the anticipation a lot of times is worse than the actual procedure itself. The procedure itself only takes about 2 to 3 minutes. Obviously, we have to numb it up first. And setting up takes a little longer, so maybe in and out in about 15 minutes. That would be normal for our practice. So what I do first is I numb up the skin. I use cold spray that helps freeze the skin to minimize the discomfort of the needle actually going in. The injection lasts about 45 seconds max. It depends if you have to stop and we kind of have to pause, and of course it's going to take longer. But after that, you're nice and numb. And I always check your toe before I do anything. So if you feel a little bit of sensation, then I go ahead and put a little more medication in. No big deal. We take our time if we need to, but hopefully it's pretty speedy and you're in and out. All right, so after you're nice and numb, I take an instrument just to help free up the nail plate. What that's going to do is help me get access to the ingrown toenail itself. Now, we typically don't have to remove the whole toenail. A lot of people think that we do. That is not the case. I just want to remove the part that's under the skin, the part you actually can't even really see. Obviously you can feel it. Get that little piece under there, remove that, and then we put a little chemical on the root of the nail. We don't want it to come back, so the chemical is necessary. Now there are occasions where we can't use the chemical. Maybe there's an infection, maybe there's something else going on, but most of the time we put the chemical on first visit, so hopefully we don't ever have to do the procedure again. With that being said, there's about a 5% chance it can return. There's a lot of factors that contribute to that. One, wearing closed-toed shoes, obviously trauma, I can't predict that. But whatever the case, as soon as you start feeling it again, 5% chance that it can return. All right, back to the procedure. So once we put the chemical on, I put a little vinegar on there to help neutralize the chemical around the skin. After that, you're done. We wrap you up in obviously a wound care bandage. We've already gone over your home instructions, so you are prepared to leave. We give you a little shoe unless you have pre-planned with a sandal or a flip-flop, because the bandage is a little bulkier that day. Obviously after that, I want you to go home, kick your foot up in the air. Don't plan on doing a lot. Unfortunately, I have a lot of patients that come in, I want to go back to work, especially my laborers, my Toyota people. I don't recommend that. Unfortunately, that does increase your risk for infection, and the numbing medicine is going to wear off. So when it wears off, your experience is going to be much worse than most. So again, go home, kick your foot up in the air, and that's it. You're in and out, 15 minutes roughly, including everything, and you're set to go for the rest of your lazy afternoon. All right, thank you.